So today I'm going to be answering the question, how to choose your midwife or OB. This is a very important part of your birthing process because your OB and provider, midwife, whoever you choose, is going to be making a lot of decisions in conjunction with you. And some providers make them without you, some walk over you, and some join with you, some support you and encourage you. So it's really important to choose the right provider for what your birth vision is. So I'm going to just go through a few questions, a few things to think about when you're trying to choose your OB or provider, and tips and tricks. So the first one is, the most popular one that I hear about is fellow referrals. So if you're talking to a friend who their OB is, oftentimes you see a lot of patients come in and they chose their mother's OB. That can be really informative, but also remember to ask a lot of questions about their birth experience. Just because they loved their birth experience and their provider does not mean they have the same birth vision as you, or they would want the same event as the friend did, right? So you want to make sure that when you're asking them, you're talking to them, you get a little more information about what that OB did, how they treated them, all of those different things, because everyone's going to have a different ideal, a different vision, and maybe you have the same vision as this friend, and that would be a good recommendation for you. The next one is call the hospital. Now, this is a tricky one because whoever answers that phone on the family birth center unit or labor and delivery unit is going to have their own opinions and ideals and preferences, right? But you'll be getting an inner look as a nurse what they think is the safest provider or the best provider from more of a medical standpoint. And that's important information to have. So I would even recommend calling the hospital multiple times, 3 times at different times of day, and talk to someone new and ask a quick question like, just looking at OB providers in the area, midwives in the area, who would you recommend for me to look into? And the nurse should be happy with giving you an answer and say, Dr. Papadopoulos or something. Just be like, oh, I love them. And then just ask a few more questions if they have time, like, what do you love about them? Or, just practices like that. That's all you really need from the nurse. The next one is when you see your provider or when you have your first appointment with a provider, that does not mean that provider is set in stone for you. Have that first appointment and make the decision after that first appointment. And remember, you can always get a new OB or midwife at any time during your pregnancy, even labor. So if you walk into that hospital and you're 8 centimeters and you are being treated not well, or you do not like how you're being treated and you've talked to them about it and the issue has not been resolved, you can get a new provider at that moment too. So just keep that in mind. But during your pregnancy, definitely, you want to make sure you have that connection and shared values. So during the first appointment, ask these questions. It is an interview. You know what? You want to interview them. You want to make sure that you are shared together in your goals. So some questions to ask is, how do they normally induce? What is their induction practice normally look like? Often OBs and midwives have a practice that they have used a lot and they're comfortable with and they feel is the best way of doing inductions, and just knowing how that would work if for some reason you needed to be induced because you're 43 weeks or 42 weeks or even 41 weeks, you're going post dates, or something's going on with the placenta or the baby. Knowing what induction looks like to them can help prepare you to see what would be the best for you. So some providers will be like, well, I do more of a mechanical induction. I put a Foley balloon up in your cervix. We stretch out the cervix with a Foley. So it's kind of like it's filled with water and it kind of stretches you out without medication. So some providers do that. Some providers do that and add Cytotec, which is a medication that causes cervical dilation and effacement. Some just go straight to the Pitocin. So all of those things will vary with different providers and midwives, and that's an important thing to look into. The next question I'm going to be talking about is what is their cesarean rates, so their C-section rates. Asking them this question is really important because if you are not a fan of the idea of having a C-section and they have rates of 70, 80, 90%, and they're not working with a really unique population that usually needs C-sections, then that's a sign to you that maybe this provider uses this as a comfort measure for themselves. They prefer C-sections, maybe they're more comfortable in C-sections, but they prefer to do C-sections. And so if you want to have C-section, then obviously they'd be the ideal provider for you. But if you are trying to prevent a C-section, unless in an extremely emergency situation, then they probably will not be the best one for you. So knowing their percentage rates of how many C-sections they do in their whole patient population that they're working with. Who takes over for them? So this is an important one because sometimes providers go on vacation or sometimes something happens and they can't make it. Whatever the reason is, who is their partner? Who will be doing your labor, your birth experience if they cannot make it? And can you meet them before your birth experience in case they do end up being your person? Now, I see this very rarely. Usually I see most providers take their own patients and will make sure that they're there for your birth, but that's not always the case. In my own case, my OB provider ended up being pregnant at the same time roughly as me. She was 2 weeks after me. So I went into labor 2 days before she had her scheduled C-section. So it ended up working out, but we were cutting it a little bit close. So I was able to meet her partner to see who would be my provider if she was unable to make it, like she was on maternity leave. And that was really nice and awesome because I liked her provider. So if she hadn't been there, I still would have been comfortable with going forward. What their goals are. So what are their goals as your OB provider, as your midwife? This is an interesting question because you're going to really get a good insight to their passion, to why they love being an OB or midwife, to what they want to do for you. So, I mean, it's just like any interview question that you may experience when you're going to get a job yourself. The manager will sit across from you and ask you, why do you want this job? Or what are you passionate about? Or all of these questions. And we're just doing the same thing to these OBs and midwives. We want to know, do you love this job? Are you going to make me feel comfortable and confident and support me? Or are you burnt out and close to retirement and you just are done? You know what? Just knowing this would really help you and kind of be a huge deciding factor in when you're choosing your OB or midwife. Next is a researcher vision. Now, all of these, by the way, are not in order, obviously, but research vision should probably be the first thing that you do. You want to know what you want. And it's hard if you've never been through labor. If you have, then you'll have more knowledge and experience in what you would like. But in a first mommy's case, it may be hard to kind of get an idea of what looks like the best experience to you. Now, obviously, you always want to be flexible because the baby may have other deciding factors that may change up your plans. Your placenta may change up your plans. There's a lot of things that can change up your plans. So be flexible, but still have that vision in mind so that when you walk in, you're like, hey, you know what? I would really love a tub birth. I called ahead, I made sure this hospital does a tub birth. I made sure my provider is very comfortable with tub births. My nurse everyone's great. I want a tub birth. But your baby does not want a tub birth. Your baby decides, no, I do not like this plan. You start seeing heart rates, decelerations, all those not fun things to see as a nurse and as a mama. So your baby doesn't like it, so you get out of the tub, right? So that's being flexible with your baby, with your body, with your experience, but you're still a part of that decision. So that's just something to keep in mind, to be flexible, but to still have that vision when you're walking in, like, yeah, I would love a tub birth. My baby decides he doesn't love it, well then okay, but I would love it. So the next one is talk to providers about your vision. Do not wait until your hospital experience, please. This is the one thing as a labor and delivery nurse that I have the hardest time with, is when a patient comes into the hospital and has a wonderful vision and has not talked about it with their provider. Because as a nurse, that puts us in a really uncomfortable situation, because we want to advocate for you, we want to encourage you and support you, but you have not talked to your provider about this, and that means your provider may not even be comfortable, may not even do them. So for example, tub births, you have to sometimes have special certification to do a tub birth as a provider. I don't know a lot about it, but I know certain trainings, certain comfort levels, tub births are very different. And that can go with many different other things that go on with birth, like spinning babies, even walking around. Some providers do not like you walking around, even if you're low risk. So you want to make sure that you talk about this with your provider. Honestly, first visit, second visit. You want to ask them, hey, my goal is to be unmedicated. My goal is to walk around, do squats, do all of those things. Is there any reason that I would not be able to do those things if you are my provider? Good question to have, and they should be honest with you. And if something weird happens and during your birth experience, you're in labor, you're unmedicated, and you're walking around and nothing new and weird has happened, like you're not preeclamptic or risk for seizures of any kind, or something odd is going on and everything's the same as it was, and they suddenly barge in and say, no, you can't be walking around, well then you can tell them, hey, remember on our second visit, I asked you and you said yes. So those things, just go over those things with your OB and midwife. Super important to go over that vision. Anything you've researched, ask them about. And then post online. Now this isn't the best, but you can get informative information when you do this. So for where I'm at, we have something called a moms group on Facebook. So I'm gonna make up one right now of where I'm not located. So let's say Southern California Moms Group. I don't know if there's a Southern California Moms Group, but I know if you go to Facebook, and often many states, there's some form of moms group in different areas. And you can join that group and just post and say, hey, who would you as a patient with experience with an OB or midwife recommend for it to be my OB or midwife? And you can kind of get more information that way of people who've had experience with this OB and midwife, what they say about them, how they felt during their birth experience, and how they were heard or advocated or listened to during this time. So that is all the tidbits, tricks, questions I have for you regarding choosing your OB and midwife. I hope this video helped you. I look forward to seeing you in the next. Just subscribe, like, and if you have any questions, please put them below in the comments. Thank you.